in backward, which is weird. After 3 months, they don't complain about that anymore. Rags, on Supra, do you have a...
Don't really see it as a problem. I do put them in a splint, a rigid splint, just to keep them in extension. I think that hematoma you mentioned is a really important part to stop them going into excessive recurvatum. But out of the patients, I've never seen it be a problem, not symptomatic.
Nico, you have something?
Yeah, I think it's the same experience that, like, I haven't seen any patient who told me or who was asking me what's happening to my knee or my lower leg. Now we're performing a study around 100 cases, and I checked them before operation, during operation, after 3 months, and then most of the time we do it in 2 steps, and then after ACL reconstruction. And what I see now in the preliminary results that between the removal of the plate, so before the revision ACL, some of them, they have still an overextension, but then after the ACL, and they always tell them,
don't be afraid.
Yeah, that's it. And don't be like, usually I have to tell them, go in full extension, and you have to work hard, pretty hard to get in full extension. Then these patients, I take it easy.
But
don't go in overextension.
In your intraoperative visualization, you see that you create substantial recurvatum or not?
Yeah.
Because my resident always say, is this normal that the leg is in? When they hold the leg, when I'm putting the plate, the compressive screw of the plate, they're like,
sure,
it's a lot. So, no, don't be afraid. And as soon as you remove everything, you undrape the patient, there is no difference. But when you reduce the osteotomy, my resident always like, you cannot fix it like that. It looks strange for 15 minutes. So 2 last slides and 2 last questions. Do you have a paper that changed your vision in osteotomy that you can recommend to our audience?
Yeah, of course, it's like the Pincheski paper and the Andreas Weiler paper about the PCL and the benefits. It's amazing if you see like the results of a PCL is 100% lying on the slope. So if you are a perfect PCL surgeon, but you have a bad slope, you end up with a bad result. So for me, it was maybe more important. I see my result is just relying on the slope in PCL. And this was the beginning for me just to think about ligament surgery and slope correction.
Rags?
Yeah, so there's a couple of papers for me and a book. So the Salmon Picheski paper, I think that was game-changing for our understanding of revision rates. And in terms of the techniques and things, the David DeJour paper, looking at his slope corrections, which he did years ago, and he followed up, I thought that was a really nice paper. But I think anyone who's starting out with osteotomies, considering slope, the doyens of osteotomy with Ronald van Heerwaarde and Alex Staubli, the Osteotomies Around the Knee AO book, is an absolute Bible when it comes to this.